What is the safest dose of testosterone that a man should take? This is a question that goes way back in time to at least the 1960s when the pharmaceutical companies produced testosterone esters. Testosterone cypionate, propionate, enanthate, Sustanon 250, even testosterone undecanate. But essentially, apart from undecanate, these are going to be moderately long-acting esters that are injected theoretically every week to every 2 weeks to every month. And we know in the medical literature, it was acceptable to inject this ester every 2 weeks. I still see that from doctors, and even every month. And this is not undecanate. This is cypionate or enanthate or Sustanon 250. Now, that's the medical world, and we don't want to disparage doctors. They're very busy, and they're not involved with steroids up until now. We hope they're going to pay attention and get on board with this and learn, because millions of people are using steroids. And the base steroid is testosterone ester. So how much is safe to take? Well, the first piece of that is that you shouldn't take any testosterone. I'm not being a wise guy, guys. Don't take any testosterone if you don't realize that it's going to shut you down and have side effects. And those are my videos. But again, when you do take testosterone and you're enjoying testosterone and you're on testosterone, it's going to be an ester. You need to understand the half-life and the dynamics of the ester. Propionate, okay, cypionate, enanthate, Sustanon 250. Those are the main esters that we use. Say, for an example, Sustanon 250 or testosterone cypionate, 200 milligrams per milliliter concentration. Bodybuilders and the ped world, it's amazing. The consensus looks like 400 to 600 a week is what they use. That's going to be way too much. My opinion, you're going to get edema. You're going to have abnormalities in the lipids. Your sex function could be really good in the beginning or it could be terrible. In the end, on that dose, it will end up being potentially terrible. I understand that some men are going to argue that, but every man is unique. But if you're on those big doses, you're definitely going to have symptoms, and your natural testosterone is going to be shut down at a certain point. How much and when, this is all man per man. Certainly if you're on testosterone esters like this dose for 2 or 3 years, or intermittently using it for cycles of 6 weeks or 12 weeks on and off, all these different regimens, you're going to be shut down sooner or later. Everyone knows that. So in the end of the day, what I could tell you is once a man is on testosterone esters and he's legitimately needs to be on those esters, the doses are much more like 100 milligrams. Again, this is going to be cypionate, enanthate, or maybe Sustanon 250, a relative dose lower because the concentration is 250 per milliliter versus 200 milligrams per milliliter. So it's quite similar. And the esters are different, right? It's those short-acting into those medium to long-acting esters with Sustanon 250. Watch the video on that. So at the end of the day, it's more like 100 milligrams every week for some men, or maybe every 3 to 4 days. So about 3.5, 4 days to maybe 7 days, that 100 milligrams. Again, this is not medical advice, guys. You gotta go see a doctor, because in the end of the day, what's the proper dose? It's a dose that you need. The least amount of the drug, the lowest effective dose to get the job done so your sex is good. You're not puffy. You don't have hypertension. It's not affecting gynecomastia, acne, depression, anxiety, your heart. Even a little testosterone will affect the HDL, guys. And if you have the potential or heart disease, it has to be considered. Blood pressure, cholesterol, sugar. These are all the things I work on. My app is coming out, and I'm going to show you how to work on all these issues independently with your own healthcare provider. You're going to do it yourself, guys, because that's the now and the future. So thank you so much for trusting me, gentlemen in the world. Do not start testosterone if you don't need it. Get baseline labs, get a health assessment. Consider that if you start testosterone, you want to take the lowest effective dose of the ester. Okay, now of course there's creams and there's pellets. This is apart from that. This is more about, in the end, most men are on intermuscular esters, certainly small amounts. It's micro dosing. But you have to consider each man. Not every man can take these baby doses every day, every other day. It's like a pincushion. In the end, 20 years later, do you think you're going to be doing that? Probably not. So you need to find the effective dose with an effective frequency of injections, which turns out to be approximately every 4 to 7 days. And that's what it is. And in the end, you have to be monitored, and you put it together, and with grace of God and good luck, you'll do well. Thank you so much, gentlemen, for continuously trusting me with your health. Thank you so much.